The skeletal system can be divided into two groups of bones, the axial skeleton and the appendicular skeleton. The axial skeleton and the fetal skull are the topic of this presentation. The axial skeleton is composed of the bones of the skull, the vertebral column bones, and what's known as the bony thorax, the ribs and sternum. We'll start by looking at the skull. The skull can be divided into two groups of bones, the cranial bones, which cover and surround the brain, and the facial bones, which make up your facial features. The cranial bones include the frontal bone, the paired parietal bones, the paired temporal bones, the occipital bone, the ethmoid bone, and the sphenoid. In the facial bones, we have the paired zygomatics, two lacrimal bones, two nasal bones, a maxilla, a mandible, a palatine bone, and a vomer. This colored skull will help us separate the bones a little better. The frontal bone is the forehead bone. The temporal bone is there in the region of the ear. The parietal bone, there are two of these, and there's two temporal bones as well, make up the roof and the sides of the brain case. The occipital bone makes up the very back of the skull and extends under to make part of the base of the brain case. The ethmoid bone makes up a small portion of the bottom of the brain case, and the sphenoid bone finishes off that bottom portion with sides extending out here to the edge. If we look at the cross section of the skull, looking down into the skull, this is the frontal bone. Here is the ethmoid bone. It's not very large. It's a rather odd-shaped bone, and this is the top of it projecting up into the skull. Here is the sphenoid bone, sort of bat-shaped. The temporal bone makes up part of the floor and comes up to make part of the sides. Here is the occipital bone. The bones are held together by joints known as sutures. These are synarthroses. They have no movement. The coronal suture is the suture between the parietal bones and the frontal bone. The lambdoidal suture is between the parietal bones, the occipital bone, the temporal bone. And the squamosal suture is primarily between the temporal bone and the parietal bone. If we look at the skull from the back, you see a better view of the sagittal suture, the one that holds the two parietal bones together, and you also see how the lambdoidal suture primarily connects the occipital bone with the parietal bones. The facial bones, we have the nasal bone, which makes up the bridge of your nose, the lacrimal bone. Now this is right in the edge of the orbit of your eye. The zygomatic bone is what we call our cheekbone. The maxilla makes up most of the roof of the mouth and most of the front of the face. It does have this bony projection that goes up between the lacrimal bone and the nasal bone. And then the mandible. The mandible is the only movable bone of the skull. Looking from the bottom, we see the maxilla and how it comes back and makes most of the roof of the mouth, but the very back part of the roof of the mouth is made by the palatine bone. And the vomer bone, we only see the bottom of it here, actually projects up to make up part of your nasal septum. There are some landmarks you need to know on each bone. On the frontal bone, you need to know the glabella, that ridge between your eyes, and the supraorbital foramen or notch. If you rub your finger along your eyebrow ridge, you will feel a slight depression. That's the supraorbital foramen or the supraorbital notch. On the temporal bone, there's some things we see from the bottom and some other things we see better from the side. The zygomatic process comes from the temporal bone to reach the zygomatic bone. This arch made by the zygomatic process and part of the zygomatic bone is known as the zygomatic arch. This opening allows some muscles to come down for jaw closure. The external auditory meatus, this is where your ear will be located. Sound will travel through this to get to your auditory nerve. The carotid canal is where the carotid blood vessels come up, and the jugular foramen is a rather large jagged opening that allows the jugular vein to exit the brain. Looking still at the temporal bone on the inside, we have the internal acoustic meatus. This is the other end of that external auditory meatus. Here you can also see the jugular foramen. On the outside, we see from the temporal bone, there is the mandibular fossa. This is this depression where the mandible will articulate with the temporal bone. Here is that external auditory meatus. Here is the mastoid process. This is the lump you can feel behind your ear. And this is the styloid process. This is again another place for muscle attachment. On most skulls, this is not this prominent because it gets broken off pretty easily. Looking at the occipital bone, the landmarks here, we have the superior knuckle line, This is where some of your neck muscles attach. The occipital condyles, these are the smooth processes that will articulate with the first vertebra. And this large opening is called the foramen magnum. This is where the spinal cord leaves the brain. Looking at the ethmoid and sphenoid bones and their landmarks, there is a crest or a ridge that stands up in the middle of the ethmoid bone. This is called the Crista galla. The meninges of the brain are attached here to help stabilize the brain and the skull. And then there are all these tiny, tiny little holes. These are called the cribriform plates. This is where the individual neurons of the olfactory nerve will come up from the nose. On the sphenoid bone, you have the optic canal. This is where the optic nerve will come through to get to the brain. And the sella turcica, the Turk's saddle. The pituitary gland sits in here. As we look on the outside, some of the landmarks on the sphenoid and the ethmoid bone. We have the orbital fissures. This is in the sphenoid bone primarily. This is how the optic nerve will get to the eyeball. And on the ethmoid bone, we have these odd-shaped things that project down into the nasal cavity. These are called the nasal conchae. These will be covered with warm mucous membranes, and as you inhale air, the air will kind of baffle around these things and get warmed up and moistened before it goes deeper into your respiratory system. The mandible, the only movable bone of the skull, has the mandibular condyle. This is what's going to fit into the mandibular fossa on the temporal bone. We have the mandibular foramen. Nerves that go to the teeth come in here. And then we have the mental foramen. This is in the chin area. This also has nerves that go to some of the teeth. The fetal skull is initially made of membranes, so this is a membranous bone kind of structure. The bones do not fully ossify until the second year of age. This leaves unossified areas known as fontanels, which are the soft spots in the infant's skull. They ossify once brain growth is complete. Each fontanel has a name. The anterior fontanel is the most prominent and the one that most of you have probably seen on an infant's skull. The sphenoid's fontanel, the mastoid's fontanel, and then the occipital fontanel. These are the four major fontanelles of the fetal skull. The three smallest bones in your body are the ear ossicles. These are actually embedded in a hollow space in the temporal bone. The malleus, the incus, and the stapes. There is one bone that does not articulate with any bone in the body. It's found in your throat, and this is this horseshoe-shaped bone known as the hyoid bone. It's embedded in muscle. Your tongue is actually attached to this bone. This is a bone that when it's broken, it tells forensic pathologists that the person was strangled. The vertebral column is part of the axial skeleton, and we have a number of vertebra. They're named for their location. So we have cervical vertebra in the neck, the thoracic vertebra in the chest region, the lumbar vertebra of the lower back, and then we have the sacrum and the coccyx, which are fused bones. So we have 7 cervical vertebra, and they're named C1 through C7. Then we have 12 thoracic, T1 through T12, 5 lumbar, L1 through L5. The sacrum is about 5 fused vertebra, and the coccyx is usually about 4 fused vertebra. This will vary a little bit from individual to individual. They usually use the idea that you eat breakfast at 7, lunch at 12, and supper at 5 to help you remember how many bones are in each region of the vertebral column. Spinal curvature is important to the way we move. An infant spine is C-shaped. If you think about it, they've been curled up in the uterus all that time. As they begin to lift their head, they begin to get cervical curvature. This is what allows us to hold our head up. And then as they begin to walk, they develop that lumbar curvature. This is what allows us to keep our balance. So normal curvature, we've got cervical and lumbar, but an abnormal curvature could be kyphosis. This is when we have an abnormal thoracic curvature. Some chiropractors say this is the natural kyphosis and this is hyperkyphosis. We're going to take the stand that kyphosis is an abnormal curvature in the thoracic spine. Lordosis is when you have an abnormal curvature in the lumbar spine. And scoliosis is when the spine does not go straight up and down the back, but there's any curvature anywhere that's a lateral curvature. The intervertebral discs are those fibrocartilage that maintain space between the vertebra. This is important to the way that the vertebra function. We have to have these little holes. These are called the intervertebral foramina. This is where the spinal nerves come out. If these holes are not maintained, the spinal nerves will be pinched. So here is a ruptured disc. This is the fibrocartilage part, and this is kind of a soft gelatinous material. If the fibrocartilage ruptures, then that gelatinous material oozes out, and it will put pressure on the spinal nerve that's trying to come off of the spinal cord through that intervertebral foramina. So this is what is going to happen. This is a pinched nerve. You need to be able to tell the three types of vertebra apart. So we've got cervical, thoracic, and lumbar. The easiest thing about the cervical, besides the fact that they're a little more delicate than anything else, is they're going to have 3 holes in them. This is where the spinal cord goes through, and in the cervical region, blood vessels go through these vertebrae. So you've got 3 holes in the cervical vertebra. The thoracic vertebra is best noted because they have this really downward projecting spinous process. We only have the 1 hole for the spinal cord, but we have this very sharp spinous process pointing downward. We also have some extra little depressions on here. Then the lumbar vertebrae tend to be rather large and chunky. They rather have a rather short spinous process, and they don't have the extra depressions that we see on the thoracic vertebra. Each vertebra have some of the same landmarks. The spinous process is the part that sticks off the back. Transverse processes stick to either side. The vertebral foramen is where the spinal cord is going to go through. And this bony structure right here is known as the body of the vertebra, or the centrum. This is where the vertebral disc is found. We have the superior articular processes and the inferior articular processes. These bones have to fit together one on top of the other. So the inferior articular process of the top bone fits on the superior articular process of the bottom bone. On the thoracic bones only, we find what are called the Costal Demifacets. These are extra depressions that allow the ribs to articulate with the thoracic vertebra. So we have the superior costal facet, and then we have the transverse costal facet. This is where the ribs can articulate with the thoracic vertebra. Since the ribs only articulate with the thoracic vertebra, we only find these structures on the thoracic vertebra. 2 of the cervical vertebrae have special shapes, and you need to know the names of these 2 vertebrae. C1 is known as the atlas, and C2 is known as the axis. The atlas is going to directly articulate with the occipital bone. So this is where the occipital condyles will articulate with the atlas. When the skull moves on these, you get to nod your head. The axis has this special projection called the odontoid process, or the dens. It will fit up into this part of the atlas. This will allow the atlas to rotate on the axis, so this is what allows you to shake your head from side to side. The sacrum and the coccyx are formed from fused bones. The sacrum typically formed from 5, the coccyx from 4. The rib cage has 7 true ribs, 3 false ribs, and 2 floating ribs. The true ribs are said to be true ribs because they directly articulate to the sternum. The false ribs articulate to cartilage, which articulates to cartilage that goes to the sternum. And then the floating ribs do not articulate with the sternum at all. As you look at the ribs, you can see where the ribs will articulate with the vertebra. This is known as the vertebral end of the rib. There will be special markings that will allow it to articulate with those facets on the thoracic vertebra. Because the rib is a flat bone, it is a spongy bone center with a compact bone shell. This end of the bone, which articulates with the sternum by using a costal cartilage, will not have a shell on its very end. So when you look at the end of it, you actually get to see that compact shell and the spongy bone center. This end of the bone is known as the sternal end because it articulates with the sternum. And the cartilage is known as the costal cartilage, costa for rib. The sternum can be divided into 3 pieces. The upper portion is the manubrium. Then we have the body of the sternum, sometimes called the gladiolus, and at the very bottom we have the xiphoid process. On the manubrium, the notch right there in the center is called the jugular notch. But on the edges of the bone, where it attaches to the clavicle, we have the 2 clavicular notches. In this side view, we can see the manubrium, the body or the gladiolus, and the xiphoid process. This is the diaphragm right here. So this is pretty much covering the chest cavity. This angle right here is known as the sternal angle, and this is at the level of the second rib. So if you want to find the second rib, you simply find that sternal angle, which you can feel, and that will be where the second rib is articulated.